Hey everybody, so I just want to do a quick message for people who think that if you live a holistic lifestyle, or if you choose not to vaccinate your kids, or if you use naturopathic medicine, homeopathic medicine, or if you're like just a very holistic person, that, and especially as a mother, that you also don't agree with medicine. So I see a lot out there in the Facebook world, and I try not to get too wrapped up in that because it's not face-to-face conversation with people. Um, but I do notice that I've seen a lot of different posts, from nurses that say, well, if you're not going to vaccinate your children, I don't want to see you in the ER. I don't, if something happens to your child, you shouldn't seek medical help if you're that against medicine. And I want to clear up that if somebody chooses, first of all, like, what a way to treat people, okay? That alone says a lot about that person and their own views. But medicine is amazing, and homeopathic medicine is amazing, and living a holistic lifestyle is amazing. And I think their purposes get very confused to regular people who don't really understand the full views on somebody who does choose to live a homeopathic life, or that doesn't vaccinate their children. It doesn't mean they're against medicine or even the science behind the vaccines, which of course makes sense, is logical, is scientific, but there's more to it. It's not black and white. It's definitely not a black and white area. And so I had to rush my baby, my 7-month-old, into the ER yesterday. He has a airway disorder called laryngomalacia, and he was having difficulty breathing. I thought that he might have aspirated food because he tends to choke when he eats at times. It's gotten much better since he's gotten older. But anyways, so we're rushing him to the ER, and it's very scary. As time's going on, he's like having, it seems like, more difficulty breathing. So I'm just trying to stay calm and keep him calm. But like in the back of my mind, I'm really thinking, am I going to get a nurse that asks me that one question about vaccinations if he's vaccinated, and then treats me a different way based on my view? And I respect medicine. I think it is amazing. I love science personally. I just believe that the medical field is meant to be used specifically, like for instances, like an emergency situation. I do think that a lot of what we deal with as humans, and even in some of the common colds and stuff like that, can be handled without allopathic medicine. And if you live a holistic or healthier lifestyle all around, you're going to help your body fight these things quicker, develop natural immunity, and so on and so forth. But overall health is the goal. I mean, that's like the long-term goal. So just because we believe in that, taking medicine doesn't help you with overall health and long-term health. It helps you manage symptoms. So you kind of have to ask yourself, when you're facing certain health issues, am I willing to just continue to manage these symptoms, or do I want to get to the root problem and try to fix this dis-ease in what dysfunction that's going on in the body? But I could go off on a tangent, obviously, about this forever, for a very long time. But I wanted to just clearly state, especially if you're in the health field, especially if you're a nurse, especially if you are in the ER, please do not treat these mothers and their babies a certain way because they choose to live a lifestyle that doesn't agree with you. And if you're also somebody who preaches for equality amongst women, or equality amongst anybody who has different sexual orientations, or gender identifications, then really it's pretty counterintuitive and it doesn't line up to your whole belief system as a whole. If you want to include all of them, but then exclude people who choose to live a holistic lifestyle or not vaccinate their children, like I know it's a very, very slippery slope to talk about. Again, I think vaccines are great. I think they have a purpose. I just believe that we can do a little more research behind them and safety amongst different populations and different children and what in children that might not be able to process properly. But again, so that's like now that's what social media has implanted in me when I'm bringing my baby to the ER and we really need help. And I'm thinking, man, what if they ask that question that in their head turns a switch that then they don't even want to care for my child like they should? And I think that's something we should all ask ourselves. Like, we're really called here to love each other no matter what and to help each other out as humans. And if we can't do that because of simple beliefs that get in the way and say, oh, you don't deserve, like it's not your place and it's not my place to say you don't deserve something because you believe differently than me or because you do this and I don't do that. And especially as a healthcare provider, man, I don't know, I work with people, women and children, and to treat somebody that would be like me saying, well, if you're going to eat fast food, I'm not going to take care of you and try to teach you how to eat healthier, or I'm not going to train you and try to get you to take steps to a healthier lifestyle. Like that, it doesn't make sense. So I just want to like really, I guess, say that take the judgments down, take the walls down. We're moms, we're parents. Our children are always first. Like, let the people that don't want to have anything to do with allopathic medicine, let them not have anything to do with allopathic medicine. But if there's a baby that needs that help, and there's a child that needs help, regardless of the decisions that the parents have made on how they want to raise their children and the level of health and awareness and science and whatever and beliefs that they want to instill in their children, it is still our duty to help those kids, and as parents really to help each other. That is just my little rant. It's a judgment-free rant. It's really just about coming together more, breaking down those walls of judgment, and allowing parents to feel safe in all environments despite what they choose. I hope that helps somebody today. I hope that resonates. And I'm very grateful for allopathic medicine, and I'm very grateful for homeopathic medicine. And my favorite thing about homeopathic medicine that I've learned over the past 3 years since having my son, my first son, is I'm a skeptic too. You know, sometimes I get these medications that are homeopathic, and I'm like, well, let's see if it works. And you know what happens? It works. And then I say, okay, well, why not? Why wouldn't I go this route first? If it's not an emergency, if it's for overall health, why wouldn't I go this route first? But when there's emergencies, thank you, Lord, there's doctors, nurses that have this insight, and that the medical field has progressed to when there's an emergency, a child can get help, an adult can get help, and then you just, like, we all benefit. So I do think there's a way to marry these two worlds that social media does not allow us to do, because, again, it is created to divide and conquer. So hopefully this video helps us all unite a little more. And I'm just grateful for everybody taking a stance and coming together, working together. Thank you, doctors. Thank you, nurses. Thank you, everybody in the medical field that does their job and puts their heart into their job and doesn't deny patients or judge patients. And I'm so grateful for the holistic medical field, the holistic field as well, and pediatrician that treat holistically first. It's been an amazing experience to learn. And the more I learn about the human body, it's just, I believe that we need to marry both of them. That's it. I hope you all have a blessed day.